Hello, 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 hello. Welcome to the Rehab Roundup. I am Dr. Hassan, broadcasting from Chandler, Arizona, or you can call it the Phoenix metro area. This week, it's a little cooler. It's actually 99 degrees as opposed to 111. Dr. Glenna Humeral, thank you for joining. We appreciate you coming on. Thank you for joining in and tuning in to the Rehab Roundup. Like I said, coming from Arizona, it is hot here, but a lot better than it was last week. Just going to give everybody a little time to kind of check in, log on, so we can talk about today's topic. What else happened today? Today was a pretty good day. I can't complain. Anytime I get a chance to wake up and see patients and get them back to their prior level of function is a good day for me. So I appreciate that. Gabrielle, thank you for joining in. I appreciate it. Dr. Erica, thank you for joining in. I appreciate that. Still waiting for a couple more people to join in before we get to today's topic. Like I said, good day today. We have, 4 or 5 admissions coming in today. So that's a good day. Had a couple patients go out. What else? We talked about the weather. Got a couple folks joining in. I'm excited. Today's topic, I think, is very timely. I'll give us maybe another minute before we kind of jump into it. If you guys have any questions before I get started, please throw that in the chat. We can talk about that too. All right. So listen, let's go ahead and get started. Welcome to the Rehab Roundup. I am your host, Dr. Hassan, board certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Today's topic is marketing during a pandemic, okay? COVID-19 pandemic has completely flipped the healthcare industry on its head. Things are not like they were before. Everything kind of locked down for most individuals middle of March, and then beginning of June, a lot of places started slowly opening things back up, and we are where we are now, where the cases in I think it's like 23 states, if not more, are increasing very rapidly. I know right now here in Arizona, we are at capacity in some of our acute care hospitals in terms of the ICU beds, which is making it very difficult. We got a question. Dr. Gabrielle had a question about how to find a biller. We'll talk about that offline, I may answer that in the chat, but I will definitely address that. So as a result of the numbers going up, increasing number of patients being hospitalized, it is very tough. So marketing during a pandemic is going to be different, right? Because right now, patients are not in the hospital. They're in the hospital, but they're not in the hospital. Patients now want to go home as opposed to going to a post-acute care setting. So they don't necessarily want to go to acute rehab, skilled nursing. They want to go home because in their eyes, home is safer. So you got to market to your audience. As a result, you have to market to patients at home. Easier way to do that, or more effective way to do that, is to partner with your home health companies. What you want to do is talk to them about a home admission program. So basically what that is they may have patients who have had some type of acute hospitalization, elected to go home as opposed to going to some type of post-acute care setting. And as a result, while they're at home, their condition may actually be becoming worse. And as a result, they're not safe to be at home. So what you can do is market to the home health company that, hey, listen, I know you guys have patients who are at home who aren't safe to be at home. Instead of sending these patients back to the acute care hospital or the ER and starting that whole cycle all over again, you can send them to acute inpatient rehab. They can get intense therapy, medical oversight, get better, go back home on you with home health services, and eventually transition to outpatient if that's feasible, or no services whatsoever. What you want to do is offer yourself up to the home health companies as an expert. That's what we are as physiatrists. We understand the post-acute care settings. We understand that space. We understand function. So you can offer up to them like, hey, listen, I'll take a look at your cases, see which patients are appropriate to transition to rehab. And then what I'll do is work with our admissions team to set up a home evaluation where our team goes into the house, assesses the patient, and if they're appropriate, along with your documentation from your home health therapist that the patient failed at home, is not safe, and can tolerate 3 hours or intense therapy, then we can bring them in. And that's basically a win-win for the patient, for the home health company, and for the acute care hospital system, because now you don't have these sick patients going into the acute care hospital and kind of bogging up that system. Another way to market during this pandemic is directly to the ERs and the observation units. So you want to specifically partner with the case managers and kind of let them know, like, hey, as a physiatrist, this is what we do. We assess patients, their function, how they're doing medically, and figure out what's the most appropriate level of care. Are they safe to go home? Do they need to go to some type of post-acute care setting? And if they do, what's the best post-acute care setting for them? Is that acute rehab? Is that skilled nursing? But you basically explain to them what you do. And you really want to focus on how you can assist them in discharge planning. Because again, you want to talk about right patient, right level of care. Because what that does is that helps prevent bounce backs. And during this pandemic, we're in such a crunch for bed capacity. It's going to help out acute care hospitals to not have patients transition into their system if they can go to a post-acute care setting like acute rehab, get medical oversight, get therapy, get better, and go back home, as opposed to potentially, clogging up an acute care bed that they'll need. And again, some of these patients, if they do bounce back, they're going to be sicker. And as a result, they may need higher level of care or services such as ventilators. And as we learned before, 2 months ago, these past 2 months, when we were really in the thick of it, ventilators are going to be a key component to helping these sicker patients, these COVID patients, recover and have a chance to recover. So we really want to make sure that we are good stewards of medical resources, i.e. ventilators, and really prevent patients from bouncing back. Another place where we have to kind of get creative and market is the surgical centers. What you want to do is market to these surgeons that, hey, you don't necessarily want this patient going home and getting worse. So what you can do is you can send them to acute inpatient rehab. They can get intense therapy, 3 hours of therapy over 5 days, or modified intensity of 15 hours of therapy over 7 days, so that they can really get good surgical outcomes. And again, we always talk about bounce back and different things like that. You want them to go home and stay home and not need to go back to the acute care hospital. You want to talk about how going to a post-acute setting like acute inpatient rehab is going to help with quicker recovery and a faster return to function. And all this helps that surgeon because it helps their numbers. Now they can say, hey, this patient had an operation, we had excellent outcomes, they did better, and they were improved from a functional standpoint, which who or what surgeon wouldn't want to market that? You also want to protect against post-operative complications. Some of the big ones pulmonary embolism or blood clot in the lungs, or deep venous thrombosis or blood clot in the leg, which can break off and go to the lungs. And if you think about that, those are pulmonary or lung complications, which can potentially lead to a patient needing a ventilator, okay? And during these pandemic times and patients being in an intensive care unit, being sick with the COVID-19 virus and potentially needing ventilators, you want to prevent patients unnecessarily needing those services, taking up those ICU beds. So that's going to be a key component that you can kind of market and put out there that I think will be beneficial to, again, patient first, the surgeon, and the hospital system as a whole, because we really have to be good stewards of resources, because this thing may get bad over the next couple months, and especially with flu season coming up as well. Last but not least, you want to market directly to physician practices, right? We still have patients who have chronic medical conditions, coronary artery disease, cerebrovascular disease, which can lead to strokes and heart attacks. Those conditions don't stop. Even if we're in a pandemic, these patients at home, these chronic conditions are getting worse. They're going to need to go somewhere. So one of the potential stops is coming to acute inpatient rehab. They're going to get intense medical oversight, intense therapy, to hopefully kind of get them more in a stable position, prevent them from needing to go to the acute care hospital, which is going to be an added benefit to, remember, first, patient first, but also that physician, because, you know, if they're in a managed care or some type of accountable care organization, they have certain metrics in terms of keeping their patients healthy and out of the hospital. So, and then also you get the added benefit, again, it's kind of a running theme, is keeping these patients out of the ER. So these are kind of 4 important places that during this pandemic, as we get more creative and pivot, you're going to hear a lot about pivot, because we're going to talk about similar topics that we probably talked about 2 months ago when we were really in the thick of things, being able to pivot and do different things, because the pandemic has really set healthcare on its head. And so we got 4 sites that we want to really look at in terms of being able to market to these individuals, to identify patients who really need our services, to get them into our care, get them better, and get them back home, and keep them out of the acute care hospital. So we got home health companies with the patients at home. We have the ER departments and observation units. We have the surgical centers, and we have the directly to the physician practices. I forgot to mention in the beginning, please share this video, and also tag a friend or physiatrist who you think may hear this. I think this is important information. Or it could be a rehab liaison, anybody in the rehab field who you think may benefit from this topic and kind of hearing this, because this is probably not something that a lot of folks are hearing, but it's really important, really helpful, really impactful, high yield, and it's going to help a lot of patients, because now we have to go to them. We have to be very nimble in our approach, and we have to pivot. So thank you for tuning in to the Rehab Roundup. I am your host, Dr. Hassan, board-certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Next week, we're going to come to you and talk about how to really work with prosthetics and orthotics companies to identify patients who may benefit from acute rehab in the community. One of the big patient populations that I can think of now are the amputees, so above knee amputations, below knee amputations. These patients sometimes go home or go to the skilled nursing setting, and these patients are super ideal for transitioning to acute rehab. So we're going to talk about how to partner with orthotics and prosthetics companies to get these patients the care that they need, get them good functional outcomes. So What I'll also do is drop my scheduling link in the comments so you can get on a free 15-minute strategy session with me so we can talk about all things the business of rehab. So thank you for tuning in. Look forward to seeing you next week, 7 p.m. Pacific time. Rehab Roundup, Dr. Hassan. You guys have a good night.